Are you tired of looking tired? And are you looking for a result with Botox to help lift your brows and make you look awake and refreshed? Today's talk, we're gonna do a deep dive into what is a Botox brow lift and how can we achieve that beautiful arched brow by using Botox. So let's get into this content today. Can Botox help you lift your eyebrows? The answer is yes, but it also depends, little asterisk there, it depends on your anatomy. And we're gonna talk about all of those things and help you understand how a Botox brow lift is achieved and what you can expect from your own Botox treatment. My name is Dr. Lynn Neiman. I am a board certified anesthesiologist and I am the owner and operator of Blossom Medical in Northern Virginia. And I am also a fellowship trained by the American Academy of Anti-Aging Medicine. I'm so excited and really honored that you joined me today to watch this video, and I hope that I answer a lot of questions for you. I am a physician, but I am not your physician. So I just want to remind you that it's important to have a discussion with your provider and that you just make sure that all of the results that you get are individualized to you, because again, you are the most important person here in the room today. And I really hope that this information really meets a need that you have, teaches you something, and gives you some important information that you can use when you go in for your own appointments or for your own treatments in the future. So let's talk about how we get a lift with Botox. It sounds really contradictory because you think that we're relaxing muscles. Isn't that necessarily going to relax the brow and make it drop? How on earth does this Botox brow lift happen? So let's talk about it. We've got a little picture, maybe up above me, and that picture shows you the muscles of the upper face. So when we think about Botox treatment, sometimes the thing that comes to mind is a wrinkle treatment. And we get it in our head that we're treating wrinkles with our Botox, but Botox isn't really a wrinkle treatment. That's actually kind of a nice side effect of what's happening with the Botox. Really what happens, the underlying thing for us to know about Botox is it is a muscle relaxer. It relaxes the muscles of facial expression because our Botox gets taken up by our nerve cells. Our nerve cells, when they don't have Botox, give a little signal to our muscles to contract. Botox acts to reduce the signaling the nerve cell can give. So if the muscles don't get that signal to contract, they just don't contract and pull as hard. When they don't contract and pull as hard, they don't pull on the skin and we don't see lines. But we can also change the way that our muscles sort of play together in terms of balance in order to do things like lift the brow. So the reason why we get a Botox brow lift is because we are going to change the tension on a muscle, and that can change the position of our eyebrow. So how do we get a non-surgical brow lift using Botox, or how do we get a Botox brow lift? That is going to depend on the interplay of the tension of the muscle. I'm going to tell you a little secret, which sounds weird, and it kind of was an aha moment for me when I put this all together, was our eyebrows aren't actually fixed to anything. They're hairs that grow at a particular location on our face, but they are not attached to anything below it. Our eyebrow position is 100% determined by our bony orbital rim that kind of goes around our eye, and then the muscles that are pulling up and the muscles that are pulling down. And so we have one muscle that pulls up on our eyebrows, and that is the frontalis, which runs across our forehead. That frontalis muscle is one broad muscle, but it's got kind of like two little bellies, we call them, to that muscle. And for some people, those muscles are kind of spread widely apart. For some people, those two bellies of that muscle are closer together. For some, it's almost completely together. But that muscle is the only muscle that pulls up. Also, you've seen a lot of people in your life, and I know that you can absolutely picture these people in your head. Some people just have more real estate on their forehead. Some people have less real estate on their forehead. But your individual muscle, your muscle shape, your muscle strength, the position of that muscle, and the real estate on your forehead are going to determine the places that I can safely put Botox in that frontalis muscle. We're going to come back to that in a minute. Let's talk about the things that pull down on your eyebrows. So the things that pull down on your eyebrows, again, if you look at my little muscle diagram, that we've put into the picture, there are a group of muscles in the middle of your forehead called your glabellar complex. It's made up of 5 muscles. There's the procerus, which pulls down in the middle, 2 lateral corrugators, and 2 depressor supercilii muscles. Those muscles are like a team. Those muscles contract together, they relax together, but they pull the eyebrows down and in when you're making that kind of concerned or thinking expression. When we treat those muscles, the opposite thing will happen. So if they pull down and in when those muscles are active, when we use some Botox in that area, those muscles will actually relax out and up. That's what gives you, or starts to give you, that medial lift. So it starts to give you that little bit of Botox brow lift in the inner corner of your eyebrow. The muscle now that goes around your eye, called the orbicularis oculi, that muscle, I always explain to my patients, is like a donut-shaped muscle, or like a bagel, or whatever you can think of that's in that shape, like a ring. That muscle, as it contracts, it gets smaller and tighter, and as it relaxes, it opens up wider. So likewise, that muscle around our eye, when it contracts, it gets smaller and pulls in, and when it relaxes, it opens up. And we can treat that orbicularis oculi, that muscle that goes around the eye, with a little bit of Botox. And that Botox can actually help to lift the corner of our eyebrow with about 1 millimeter or 2 of lift at the corner or the tail of the brow. So we can lift medially by treating the glabellar complex. We can lift laterally by treating the orbicularis oculi. And when we treat crow's feet, so now if we extend down and treat a little bit more around the eye, we can actually give ourselves a little bit of opening in that lateral part of the eye. That's what actually starts to give us our eyebrow lift. So we're lifting medially, we're lifting laterally. Now let's come back to this guy in the middle that we talked about, that frontalis. The complicated thing about the frontalis is that even though I said it kind of has 2 bellies to that muscle, it really has almost 3 portions to that muscle. So it's got, I'm going to use my fingers here to demonstrate. These little guys on the outside, that's that lateral portion, and the guys in the middle, that's the middle portion of that muscle. If we make the middle portion of that muscle sleepy, what happens is the lateral portion of that muscle, so the outer corners of that muscle, start to get a little bit worried because the guy in the middle isn't doing his job anymore. So that portion of the muscle will actually pull it into overtime and do a little extra work. So if we make the middle portion sleepy and don't treat the outer portion quite as much, we're now creating an imbalance in that muscle so that the outer portion of the muscle overworks and will actually help to lift a little bit more. So we're purposefully treating the middle part of that muscle more than the lateral part of our muscle in order to recruit the lateral portion of the frontalis to add some lift. Not everyone's frontalis will follow these rules. If you have a frontalis that is maybe actually very small and is strong very low to your brow, sometimes I can do this for you and get a lot of brow lift, but sometimes I can't treat the frontalis fully because you might have some side effects. So another thing that happens is sometimes I can get you brow lift, but you might develop something that's called a little comma, where we have a little bit of line that forms almost in the shape of a comma by the side of the brow. And that's because we're asking that lateral portion of the muscle to work, and as it works, you might see a little line that forms here. Sometimes we can treat that line. Sometimes when we treat that line, the lift comes down just a little bit. So there are pluses and minuses here. For some people, that brow lift is going to be profound and beautiful. For other people, in order to get that brow lift, we may develop some commas or we may have some lines laterally. And some people are going to come in and they're going to say, at least to me as a provider, that, well, they have a beautiful lift, but they don't like what they see laterally and they want that treated. As we treat laterally, we're going to lose the ability of recruiting that muscle to do some of the lifting. So you may not have as much lift in the future. So can everyone get an amazing arched brow lift with Botox? My answer to you is no. We definitely can get some lift, And typically that lift is going to start with the glabellar complex and the orbicularis oculi. And then that frontalis is really going to change from person to person in terms of how we can treat that frontalis and how much lift we can get. Another thing that I do want to just say, and I think it's really important, and this differentiates especially a surgical brow lift from a Botox brow lift. If you are coming into me and you already have a brow that's a lot lower than the orbital rim, we call that a natural brow ptosis. P-T-O-S-I-S. That's the word ptosis. It just means it's a low lying. If that is already the case with your anatomy, we have to be concerned that treating the frontalis at all may make that situation worse. You may have a worse or low-lying brow ptosis. That's a discussion that you need to have with your provider, that I would have with any of my patients, because there could potentially be a complication or an unwanted effect in trying to get you a brow lift if you already have a resting brow ptosis. Also, some people naturally have a little bit of lid ptosis, but a lid ptosis is when the eyelid kind of closes just a little bit, and that can be a side effect from Botox, but some people actually have a resting lid ptosis that's natural to their anatomy. And if that's the case, we need to evaluate what the risks, the individual risks to you might be of trying to get a brow lift with Botox. So, can we get a brow lift with Botox? Absolutely we can, and it can look beautiful. But not every person is going to be able to get a brow lift with Botox. And that comes down to the fact that your face, your muscles, and the way that those muscles play together is individual to you. And so even though there is a strategy for getting a Botox brow lift, that may be appropriate for your friend or your sister or somebody else that you know, it doesn't necessarily mean that it's going to work for you. And that is something that you need to evaluate with your provider, and your provider needs to go over the options, the risks, and the benefits and tell you when maybe that natural brow ptosis that you have is really truly only going to be corrected with a surgical correction. Trust any provider that talks to you about what they can't do with their product. So if they tell you, I can't get you the result that you're looking for with a Botox brow lift because of your natural anatomy, trust that what they're telling you is good for you, because absolutely everyone wants you to have your best results. I am a physician, but not your physician. So remember, the conversations we're having here are general conversations so that you can have this information going into an appointment. If your brows are something that you want to have treated in a positive way by a Botox treatment, have that conversation, talk about options, risks, and benefits, and really be sure that your provider is assessing your own individual anatomy so that that person can make sure that they are providing you with the best possible care. I am Dr. Lynn Neiman. Again, I am a board-certified anesthesiologist and provider here at Blossom Medical. I would be so excited if you wanted to come into Blossom Medical in Northern Virginia and have a consultation with me where we can go over your own anatomy. We can map where a Botox treatment might help you out. And we can specifically talk about the ways that we can potentially treat your upper face in order to give you that beautiful Botox brow lift and give you that really amazing, awake, refreshed, beautiful look that we can get with Botox. Also avoiding some of the complications that we don't want to see with Botox, like an overarched brow. But if you are not here in Northern Virginia, we also offer virtual skincare consultations, and we would love it if you would reach out to us with any of your skincare concerns. We offer nationwide an opportunity for you to have a skincare consultation where we can go over your skin, your skincare needs, and we can customize a skincare program for you and ship it directly to your door. And if that's something that's of interest for you, you can definitely look in the comments below where you'll find more information. If you see that ... click there, and that will tell you where to go and find the links for all the information that you've seen in this video today. I certainly would love it and appreciate it if you would like and subscribe. And if you know anyone else who you think might find this content really helpful or informative, absolutely, I would appreciate it greatly if you would share it with them. Let me know if there's anything that you want to discuss in the future, and I hope that I've given you some information that will really help you make great decisions going forward, that you feel educated and can make beautiful choices for your own aesthetic treatments in the future. Thanks so much for tuning in, and I will look forward to seeing you next time.